Next, Dr. Vivek Badge.
My study is a comparative study between sliced tragal cartilage and versus temporalis fascia graft in type 1 tympanoplasty. Introduction would be permanent perforation of tympanic membrane resulting in sequel of CSOM is a major cause of deafness. CSOM is a long-standing infection of part of whole of a middle ear cleft characterized by intermittent persistence or purulent drainage through a perforated tympanic membrane. It is one of the most common ear diseases encountered in developing countries due to poor socio-economic standards, lack of hygiene, and health education. Healing of tympanic membrane is preceded by ingrowths of connective tissue edges over which epithelium migrates close to perforation. Keeping this physiological principle in consideration follows that connective tissue grafts of mesodermal origin like perichondrium or fascia prove superior to all other graft materials. That's why in this study we have used perichondrium and fascia. Clinical investigations have shown that these connective tissue replace that missing fibrous element of tympanic membrane and allow squamous epithelium and mucosal tissues to cover the medial and lateral surface. And the ideal grafting material used for sealing the tympanic membrane perforation should have a low rejection rate, sufficient quantity and good tensile strength, conductive properties similar to that of tympanic membrane and equal thickness and easy availability. These are the qualities. Membranous grafts like temporalis fascia and perichondrium meet these criteria and result in closure of tympanic membrane perforation in most cases. This is tragal cartilage graft and harvesting. We take an incision at tragus and we cut it by tragal slicer and we use it sliced tragal cartilage island perichondrial graft. This is the sliced tragal cartilage island perichondrial graft and a notch for malleus. Placement of sliced tragal cartilage island graft with perichondrium resting on canal wall. View of graft after repositioning of the tympanomeatal flap. This is temporalis fascia graft technique. We harvest the graft. Aims and objectives. Primary aim is to assess and compare the improvements in hearing amongst patients with sliced tragal cartilage graft and temporalis fascia graft in type 1 tympanoplasty relative to preoperative PTA findings. And second primary aim is to compare the results of these two graft material in terms of graft uptake. Secondary is to study the demographic and clinical profile of patients undergoing type 1 tympanoplasty and to assess complications occurring during this process. Materials and methods. Study design, this is a prospective observational kind of study and sample size is total 60, 30 for each group. Study duration is 18 months. Inclusion criteria will have had patients of either sex in age group of 18 to 45 years, patients having good general physical condition, patient not having any evidence of any infection in nose, throat or paranasal sinuses, patients having central perforation of pars tensa of tympanic membrane, patients with a dry ear for minimum period of 3 weeks, 21 days before the day of operation, patients having good eustachian tube function and good cochlear reserve. And exclusion criteria is everything excluding that is 18 patients less than 18 years and more than 45 years, and pregnant females, patients with marginal perforation, patient presenting with polyps, granulation, cholesteatoma, and patients who had already undergone myringoplasty in the operating year. And in methodology, we did all 60 cases complying with the inclusion criteria were selected using non-probability convenient sampling technique and were equally divided into two groups using simple randomization technique. Using lottery method, the patients were briefly informed about participating in study, and all of those who met the inclusion and exclusion criteria were enrolled. After being informed, written informed consent was obtained from eligible study participants and their relatives at the beginning of study. Their detailed history and findings were recorded in a specially constructed performa. All patients underwent routine blood investigations, including hemoglobin count, total count, differential count, urine examination, Ramdell blood sugar, HIV, HbCG, X-ray, chest X-ray, PA view. They also received otological examination, pure tone audiograms of both their ears and bone conduction. Position was supine and with opposite ear fixed in the ring. And it was either done in general anesthesia or local anesthesia with sedation. As you all know, it is underlay type 1 tympanoplasty. Follow-up schedules, we followed up them in 3 times at first month, third month and 6 months. We also did we also took autoendoscopic pictures all these times. Relevant ENT examination, conditions of the flap, improvements of symptoms and next line of management. Monitoring, vitals, routine investigations. These were done in monitoring. Observation and results. So after this thorough study, we observed that association between follow-up and outcomes of the grafts in majority of patients, 28 with temporalis fascia and 29 with tragal cartilage, did not experience graft failure. The chi-square value was 0.345 with p-value of 0.557, indicating that difference in the graft uptake failure between temporalis fascia and tragal cartilage was not significant, not statistically significant. As you can see, the distribution of patients according to failure of graft, the failure of graft uptake in temporalis fascia was 2 out of 30 patients, and in tragal cartilage was 1, which was negligible. Association between follow-up and outcomes of types of grafts, first month follow-up, third month and 6 months follow-up. And this is distribution of patients according to hearing outcomes, ear-bone gap during follow-ups, first month, third month and 6 month follow-ups. So it was not statistically, the failure rate was, graft uptake failure was not statistically significant. This is first month follow-up of tragal cartilage graft. This is picture of tragal cartilage graft post-operative at 3 months. This is 1 month post-operative image of temporalis fascia graft. This 3 month post-operative image of temporalis fascia graft tympanoplasty. So the summary is, there was no significant difference in results. That is, the majority of patients, 28 with temporalis fascia and 29 with tragal cartilage, did not experience the graft failure. Additionally, the study highlights the importance of understanding and effectiveness of different types of grafts. So in conclusion, in present study, the majority of patients undergoing graft procedures were young adults, nearly equal distribution between the type of grafts used. The findings highlight that temporalis fascia and tragal cartilage are equally effective graft material with regard to closure to airborne graft and graft uptake. These results advocate for continuous post-operative care, highlight the need for patient education regarding potential complications and follow-up requirements to ensure optimal outcomes. Thank you.
I would request Dr. Amit Pradhan sir to hand over the certificate to Dr. Vivek.